Tanvi, what happened? Shavan, why are you presenting? Stop presenting, Shavan. And you all can leave the class now, beta.
Excuse me, ma'am.
Good afternoon, Vita. Good afternoon, everyone. All the best to you.
Good afternoon, ma'am. Shall we start?
Yes, very good afternoon, Sonal.
Good
And
afternoon,
welcome all the participants. I think now you may start. Just Sonal started exactly 12:30.
Right, ma'am. Right, ma'am.
Hello. Air Force वाला ना? वही तो पता करना है ना? और स्कूल से चेक करो, बद्दी इंटरनेशनल स्कूल, पता नहीं मांजना ऐसे क्या नाम है उस जगह का। हाँ 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 जी हाँ जी, है ना? हाँ ओके। नहीं क्या मीठा नहीं, मेरे को दे गए हैं सर। मैम मैंने ना तेरे लिए ना पीस कर दिया सारे पूरे स्टाफ के। ठीक है। Sonal ma'am, you may start now.
Yes, ma'am. Yes, ma'am. Good afternoon to one and all present here. Honorable Principal ma'am, Seema ma'am, respected judges, and my dear participants. On behalf of Social Science faculty, I welcome you all to the live streaming of Model United Nations. Before we start, I would like to seek permission from our worthy principal ma'am.
Please go ahead.
Thank you, ma'am. The judges for today's event are Mr. Pankaj Gupta, Mrs. Veena Thakur, Mrs. Neha Sharma, Ms. Shivani, and Mrs. Natasha. Here, I would like to tell everyone that our finalists have put in rigorous efforts and have done a lot of research work for sharing the information with all of us. They have been working hard from last many days. Without taking any more time, let's start today's event. Over to you, Chairman Himika Kansan. Thank you.
Good afternoon, distinguished guests, respected teachers, and delegates. Today, I, Himika Kansal, as Secretary General of MUN, welcome you all to this committee. I'm both pleased and impressed to be surrounded by so many bright and inspirational young delegates. The theme for this session is Impact of COVID-19 on Mental Health and Stress Disorders. This is a critical issue, and I firmly believe that this session of MUN will do much to help in addressing each and every issue facing humankind today. You all hold the keys to the future in your hands. So, all the best to everyone. Without any further ado, I pass this order to start the committee. Attendance round. Delegate of Australia.
Present and voting.
Delegate of China.
Present and voting.
Delegate of France.
Present and voting.
Delegate of Germany.
Present and voting.
Delegate of India.
Present and voting.
Delegate of Iran.
Present and voting.
Delegate of Japan,
Present and voting.
delegate of Russia,
Present and voting.
delegate of Spain,
Present and voting.
delegate of UK,
Present and voting.
delegate of USA.
Present and voting.
Now general speech round. Delegate of Australia,
That depression can be felt different by everybody. But it's okay to take help because we were never meant to do this alone. Greetings, Honorable Chair and delegates present in the House. Delegate of Australia is here and wants to state that during the peak of the outbreak in Australia, the rate of psychological disorder and depression symptoms rose among adults. Worryingly, around half of the Australia's population reported a decline in their physical health compared with before the pandemic began. 75% of them reported a decline in their mental health too. Because of this sensitivity, it is likely that social distancing measures, together with school closures, may have a greater negative impact on adolescents. The citizens also reported feelings of loneliness, which were associated with increased psychological distress and reduced sense of well being. Even more than 95% of citizens of Australia reported engaging in online learning, and the majority said this had a greater negative impact on their mental health too. At last, the question arises, is the government trying to overcome this? Yes, why not? The government of Australia is trying to overcome the situation, and for that, it has reduced online study time for students and has taken several another initiatives. Thank you.
delegate of Australia. What's your call? Would you like to devote your time to another delegate or utilize it yourself?
Delegate of Australia would like to utilize this time.
Any questions to delegate of Australia?
Delegate of USA want to ask a question to Delegate of Australia.
Please proceed with it.
Delegate of Australia, your question is, what precautions is the government of Australia taking for fighting with COVID-19, or they are only working on mental health of people?
Thank you, Delegate of USA. I'm delighted to answer your question. The government of Australia is not only working on mental health, but is also taking precautions to fight against COVID-19. And the precautions taken are necessity wearing of masks, proper social distancing, and sanitization of each and every public place after 10 to 15 minutes. Thank you.
Delegate of China.
Good evening, honorable chairs and my fellow delegates. The delegate of China would like to state that COVID-19, a disease that started from China and now has affected the entire world, was first identified in December 2019 in Wuhan, China. By 29th January 2020, the virus spread to all provinces of mainland China. The current situation in China is under control, but even though there are hardly any new cases, this pandemic has affected the mental health of the people. In China, the public has shown severe anxiety related behaviors and poor sleep. According to an online survey, depressive and anxiety symptoms were more likely to occur in people younger than 35 years. When compared with other professions, healthcare workers are at a higher risk of poor sleep. There have been ongoing measures and efforts in China that emphasize the importance of dealing with these mental health issues. The National Health Commission of China has released principles for the emergency psychological crisis intervention for this COVID-19 pandemic. Mental health hotlines were quickly established across China to deal with these mental health issues and provided the public with counseling and psychological services. The Chinese government, as well as the people, have done a great job in dealing with these mental health issues during this COVID-19 pandemic. Thank you.
Delegate of China, what would you like to go for? Devote your time to another delegate or utilize it yourself?
The delegate of China would like to utilize the time.
Any questions to delegate of China?
Delegate of France would like to ask question from delegate of China.
Please proceed with it.
China was the pioneer of coronavirus disease before becoming a pandemic, but the death toll of China is still static as compared to other countries. What is the reason behind it?
Thank you, Delegate of France. Yes, it is true that the death toll in China due to COVID-19 is very low as compared to other countries of the world. But there are a couple of reasons for it. The first being that when the situation in China was really bad, many cities went into a complete and strict lockdown, and people took those lockdowns very seriously. The second being that in China, there was never a discussion about keeping the economy going or saving lives. From the very beginning, it was very clear that each and every life mattered. So, the cooperation of people has resulted in the low death toll of China due to COVID 19. Thank you.
Delegate of France.
No matter where you are, no matter how low you have sunk, no matter how bleak your situation is, this is not the end. This is not the end of your story. Good afternoon, honorable chairs and my dear fellow delegates. Delegate of France wants to state that French population mental health was severely impacted at the beginning of lockdown, with anxiety disorder twice as prevalent. Santé Publique France launched a survey to monitor population's mental health and behavior. They set up a mental health helpline linked to the national telephone helpline, providing information on COVID 19. Population mental health then progressively improved, in particular after the end of lockdown. People with experience of mental ill health and financial difficulties continue to report high levels of anxiety. These results highlight the important impact of economic factors, which have led all countries under lockdown to for a progressive relaunch of economic activities. French social and economic protection systems are likely to have played an important role in cushioning the effect of epidemiological crisis on population mental health. And when the danger will pass, people will join together again. They will grieve their losses and will make new choices, will dream new images and will create new ways to live. Delegate of France would like to repeat when the danger will pass, people will join together again. They will grieve their losses and will make new choices, will dream new images and will create new ways to live. Thank you.
Delegate of France, what would you like to go for? Utilize your time or devote it to another delegate?
Delegate of France would like to utilize its time.
Any questions to Delegate of France?
The delegate of Spain would like to ask a question.
Please proceed with it.
As the delegate of France had explained that the Santé Publique France launched a survey to monitor people's mental health. So, according to the research, what was the percentage of people suffering from mental health problems during the lockdown and before it? Was it the same or there is any change?
Thank you, Delegate of Spain. So, according to WHO World Mental Health Survey in 2018, France was one of the countries with highest rate of diagnostic and statistical high rates of anxiety and mood disorder. Before coronavirus, 32% of total population suffered from mental illness, which then increased by 63.5% at the beginning of lockdown. Santé Publique France launched a survey to monitor population mental health and behavior. In order to quickly collect useful data to coordinate a preventive response, the survey looked at the degree of adoption of hygiene measures and physical distancing. Thank you.
Delegate of Germany.
Mental health problems don't define who you are. They are something you experience. You walk in the rain and feel the rain. But importantly, you are not the rain. A very hearty good afternoon to honorable chairs and dear delegates. The delegate of Germany would like to state that the COVID 19 outbreak is the most devastating pandemic since the Spanish flu in 1918. So, the lockdown induced by novel coronavirus has brought the lives of people at an absolutely standstill. Hanged inside their homes for months, as the pandemic raged outside, millions of people are emerging into a world that has drastically changed. An uneasy adjustment process resulting in a spectrum of mental health issues, ranging from depression to that final step, suicide. Faced with new realities of working from home, temporary unemployment, homeschooling, etc., it is very important for people to take care of their mental health as well as their physical health. So, the government of Germany is supporting community actions that strengthen social cohesion and is investing in mental health interventions. Germany has successfully established Kurzarbeit, a program through which 10 million Germans are benefited. Even the Germany's telephone counseling, the telephone Seelsorge, is doing quite good. People are also doing exercises, yoga, meditation, and are taking lockdown as the best time for self introspection and improving themselves. So, hope itself is a star, not to be seen in the sunshine of prosperity, and can only be discovered in the night of adversity. Thank you.
Delegate of Germany, what's your call? Would you like to devote your time to another delegate or utilize it yourself?
The delegate of Germany would like to utilize its time.
Any questions to delegate of Germany?
Delegate of Russia would like to ask the question.
Please proceed with it.
Delegate of Germany, you mentioned that government of Germany is investing in mental health interventions and strengthening mental health services and programs. And you also mentioned a program named Kurzarbeit that is benefiting 10 million Germans. Could you please put some more light on this program?
Thank you, Delegate of Russia. The Delegate of Germany is delighted and proud to tell about its excellent program, Kurzarbeit, that is Germany's short time work scheme. It is a social insurance program whereby employers reduce their employees' working hours instead of laying them off. Under Kurzarbeit, government normally provides an income replacement rate of 60%. It is an excellent crisis management tool as it prevents workers' income. So, this program has kept employment stable in Germany during this global financial crisis. Thank you.
Delegate of India,
Thoughts can leave deeper scars than anything else. So it's important to fight and fight again. COVID-19 pandemic presented as a black swan event. The delegate of India would like to state that though there is uncertainty about when the pandemic will end, and it creates fear among people, leading to severe mental health issues. But still, being with yourself and your loved ones will certainly have a good result. There is a shift of positive attitude towards mental illnesses in India. Family is very important in India. However, the reports of World Health Organization states that about 7.5% of Indians suffer from mental health illnesses. But now, these figures are plummeting and education and awareness is spreading. To cope up with mental health issues, people in lockdown are moving towards exercising, getting sufficient sleep, and eating a healthy, balanced diet. People are also moving towards new hobbies, which is like the food for the soul. The National Institute of Mental Health and Neuroscience is also providing people helplines and guidelines. There needs to be a lot more communication about mental issues in India, and happily, India's government is working towards it. Happiness can even be found in the darkest of times, if only one remembers to switch on the light. Thank you very much.
delegate of India, what would you like to go for? Devote your time to another delegate or utilize it yourself?
The delegate of India would like to utilize the time.
Any questions to delegate of India?
The delegate of Germany would like to question the delegate of India.
Please proceed with it.
As you said, living with families will certainly have a good result. But let me remind you, still, there are many people who can't get along with their families, which results in poorer outcomes and more conflicts. So, how is India going to tackle this?
Thank you, delegate of Germany. As it is said, new pathways create new hopes. So, this pandemic has created the need of virtual families. People are communicating with their families virtually through mediums like Google Meet, Zoom, WhatsApp, Skype, and video and audio calling is also quite prevalent. So, just because no one else can heal or do your inner work for you doesn't mean that you can, should, or need to do it alone. Always seek out for help. Thank you very much.
Delegate of Iran.
Coronavirus, a word that creates a sense of fear in many people as soon as they hear it. But can 200 countries together not deal with this one virus, which is ruining the life of so many people? Iran thinks we all can. The world unitedly can definitely win the pandemic fight. Greetings, honorable chairs, and my fellow delegates. The delegate of Iran would like to state that mental health was already a neglected issue globally before the pandemic, with close to 1 billion people living with a mental disorder. And now the question emerges that as the coronavirus pandemic is rapidly sweeping across the world, is there any positive change seen in the mental health of Iranians? Or is it still deteriorating? Of course, the lack of social interaction is worstly affecting their mental health. Just the fact that someone is COVID positive can induce stress and anxiety in them. But Iranians are prepared for the worst and have always hoped for the best. The country is really very thankful to the WHO, as the WHO, with its partner organizations, would call for a massive scale up in investments in mental health. Iran itself is also striving to deal with the crisis, and it would always hang in there. Just remember, the struggle we are in today is developing the strength we need tomorrow. Thank you very much.
Delegate of Iran, what would you like to go for? Devote your time to another delegate or utilize it yourself?
The delegate of Iran would like to utilize the time.
Any questions to delegate of Iran?
The delegate of Japan would like to question the delegate of Iran.
Proceed with it.
The delegate of Iran has just said that Iranians are prepared for the worst and are hoping for the best. So, I would like to ask you, is only hoping enough, or Iranians are doing something as individuals to tackle with this problem?
Thank you very much, delegate of Japan. The delegate of Iran would surely be delighted to answer this question. No one should ever lose hope, and Iranians are doing the same. Moreover, they are not only hoping, but even making efforts to resolve this problem. Keeping the COVID precautions in mind, they all are staying at home and helping each other through social media. They are even changing their daily schedules to lead a happy and healthy life. Thank you very much.
Delegate of Japan.
There are no visible symptoms, no runny nose, just a head full of darkness. No fever or no rash, no fractures or sprains, just a longing for something unable to explain. A very good morning to one and all present here. Today, the delegate of Japan would like to put forward some views on the topic impact of COVID-19 on our mental health. To those who have struggled with real mental health issue, so sorry. You have to watch people trying to turn it into a fashion trend. Surprised? But it's true. People have turned words like anxiety and depression into a trend. But what if the person is actually suffering from it? So, never give up on someone struggling from mental illness. When I is replaced by we, illness becomes wellness. In Japan, the mental health condition may be particularly vulnerable during the ongoing COVID-19 crisis. So, to overcome this, Japan has launched a campaign called Akita Prefecture. Japan also has a very famous tea ritual of tea ceremony called Cha no Yu. It represents purity, harmony, and peace. Mental pain is less dramatic than physical pain, but it is more common and also more hard to bear. For example, it is easy to say my tooth is aching than to say my heart is broken. Remember, to gain peace of mind, only you, yourself can help you. Thank you.
Delegate of Japan, what's your call? Would you like to devote your time to another delegate or utilize it yourself?
The delegate of Japan would like to utilize the time herself.
Any questions to Delegate of Japan?
The delegate of China would like to question the delegate of Japan.
Please proceed with it.
The delegate of Japan just mentioned that Japan has started a preventive campaign called Akita Prefecture to deal with these mental health issues. How far is this campaign successful?
Yes, the delegate of Japan would surely answer the question asked by delegate of China. Our recent studies have shown that prevention campaigns such as Akita Prefecture have significantly resulted in the decline of suicide rates by 20%. Hence, Akita Prefecture is a very successful and helpful campaign launched by the government of Japan.
Delegate of Russia.
Good afternoon, honorable chairs and fellow delegates. Delegate of Russia would like to state that mental illness is a major health burden with substantial social and economic consequences. Russia is among the 10 most affected countries in the world by COVID-19. In Russia, atmosphere is quite stressful, both for people and state, where everybody wants to go back to normal life. Tension and stress seems to be a more significant challenge now. Public health actions such as social distancing can make people feel isolated and lonely and can increase stress and anxiety. But with all these, people really want to go back to normal life. As it is said, the more we understand stress, the better we can tackle it. So, the people of Russia are using the guidelines given by the government. Nevertheless, social distancing is strictly practiced. Lockdown has also helped in slowing down the spread of infection as agreed by World Health Organization. With all these, Russia is also working towards finding a cure to fight COVID-19. Russia has already proposed 8 anti-COVID-19 vaccines to World Health Organization. Coping with stress in a healthy way will make you, the people you care, and the community stronger. The bravest thing we all ever did was continuing our life when it was hardest to live. We all will watch ourselves bloom again. Thank you, everyone.
Delegate of Russia, what would you like to go for? Devote your time to another delegate or utilize it yourself?
Delegate of Russia would like to utilize its time.
Any questions to Delegate of Russia?
The delegate of UK would like to ask a question from delegate of Russia.
Please proceed with it.
So, delegate of Russia, what are those guidelines that your government has provided to prevent the cause of this pandemic?
Thank you, Delegate of United Kingdom. Delegate of Russia is fortunate to answer your question. Guidelines given by our government to prevent this pandemic are 6 feet social distancing, covering face properly with mask, washing hands often with soap or alcohol-based hand sanitizer, covering nose or mouth while coughing and sneezing. They also suspended the entry of foreigners from all other countries. Government and Bank of Russia will continue to take measures to ensure financial stability. But government of Russia also said that it also depends on our own attitude and how responsible we are about our own health and health of our loved ones. So it is necessary to stay at home and restrict all contacts. Thank you very much.
Delegate of Spain.
Good afternoon, everyone. The delegate of Spain would like to state that the Kingdom of Spain, a developed country, also being the 14th largest economy of the world, was gravely engulfed by the contagious COVID-19 pandemic. Being the worst hit country of Europe, the country is also facing the challenges of deteriorating mental health. Poverty has hit every facet of society due to alarming 7.35 lakh COVID cases and a very high death rate of 4.3%. Mental stress, depression, and anxiety have added more to loneliness and isolation due to socialization norms. Increase in substance use disorder and drug addiction has emerged as a new threat. Lockdown on economic productivity has also impacted the adult population. Mental disorders of sleeplessness and anxiety have crippled the country's population. Phobic and obsessive compulsive disorders are surfacing as new mental health deterrents. Decrease in family values and societal engagements have brought in mental discomforts. The liberal democracy of the country is now finding ways out to uplift the social and mental morale of the citizens so as to welcome a new smiling Spain. Thank you very much.
Delegate of Spain, what would you like to go for? Devote your time to another delegate or utilize it yourself?
The delegate of Spain would like to utilize the time.
Any questions to Delegate of Spain?
The delegate of Iran would like to question the delegate of Spain.
Proceed with it.
The delegate of Spain just mentioned that the liberal democracy of the country is finding ways to welcome a new smiling Spain. So, is it still finding ways, or has it even taken some steps to reduce the mental disorders in the country?
The delegate of Spain would request the delegate of Iran to repeat the question.
Is the liberal democracy of your country still finding ways, or has it even taken some steps to reduce the mental disorders in Spain?
Thank you, delegate of Iran. Delegate of Spain will surely put light on your question. Yes, several steps were taken by the Spanish government to reduce mental health problems. But the most easiest and successful steps were like massive information, education, and communication activities regarding good mental health. Thank you.
Delegate of UK.
Life is 10% what you experience and 90% how you respond to it. Creating a healthy mindset is an investment in your overall well being. A very good afternoon, honorable chairs and dear delegates. Today, the delegate of the United Kingdom is delighted to be a part of this MUN and wants to state that the COVID 19 pandemic in the United Kingdom is a part of the worldwide pandemic of the coronavirus disease 2019, which has affected millions of people across the globe. But now the question arises, how is this pandemic affecting the mental health of the people? So, more than two-thirds of the adults in the United Kingdom report feeling somewhat or very worried about the effect COVID 19 is having on their life. Various psychological problems in terms of mental health, including stress, depression, and frustration, uncertainly during COVID 19 outbreak, emerge progressively, which has led to short-term as well as long-term mental health implications for children and adolescents. But the people of United Kingdom believe that they can overcome this problem in the coming years. The government of UK is also on a high alert since March and is taking appropriate steps to prevent the cause of this pandemic. At last, remember that blue sky. It may at times be covered by the dark clouds, but it is always there. This pandemic is also like a dark cloud covering the whole world. But you need to remember that every cloud has a silver lining and believe that eventually one day the sun will come out and that dark cloud is going to dissolve and fade away completely. Together we create, together we fight. Thank you, everyone.
Delegate of UK, what would you like to go for? Devote your time to another delegate or utilize it yourself?
The delegate of UK would like to utilize the time.
Any questions to Delegate of UK?
Delegate of Australia would like to question the delegate of UK.
Please proceed with it.
As the delegate of UK mentioned in her speech that various steps are being taken to tackle this problem, what were those steps and how were these steps helpful for the country?
Thank you, Delegate of Australia. The Delegate of UK is delighted to answer your question. Yes, various steps are being taken up by the government of UK to prevent the cause of this pandemic, as a nationwide lockdown was announced in the country, which has brought a change in the mental health of the people. As during this period, the depression level has decreased and life satisfaction got increased. Various other steps were also being taken up by the government of UK, and we believe that these steps are certainly going to bring a big change. Thank you.
Delegate of USA.
What mental health needs is more sunlight, more candor, and more unshamed conversation. Good afternoon, everyone. Delegate of US, that is, United States of America, wants to state that as the number of COVID 19 cases increases, so does the associated anxiety. As social distancing takes place in many US states, doctors fear an uptick in physiological trauma among the quarantine. For the government of America, the mental health effects of COVID 19 are as essential to address as are the physical health effects. And for the one in five who already have mental health conditions, or the one in two who are at a risk of developing them, we need to take personal, professional, and policy measures to address them. To aid individuals and communities during this time, Mental Health of America has compiled a range of resources and information. The federal government of America works in partnership with the states to address mental health. The federal role in mental health includes regulating system and providers, protecting the rights of consumers, providing funding for services, and supporting research and innovation. As a major funding source for mental health services, the federal government establishes and enforces minimum standards that the states can then expand upon. Remember, your present circumstances don't determine where you can go. They merely determine where you can start. Thank you, everyone.
Delegate of USA, what's your cause? Would you like to devote your time to another delegate or utilize it yourself?
Delegate of USA want to utilize the time.
Any questions to Delegate of USA?
The delegate of India would like to question the delegate of USA.
Please proceed with it.
Thank you. Though USA might have done a lot to reduce the mental health issues during the lockdown period, but still, the poor outcomes of the lockdown, like job loss and isolation, as mentioned by the delegate, are not taken care of. Explain what USA's government is doing for the same.
Okay. Delegate of USA would be delighted to answer the question asked by Delegate of India. Although unemployment rate fell to 10.2% in July and the rate of job creation was also slow, but the government is reducing red tapes to increase job creation and avoid copying interventionist measures. Thank you.
Resolution round. Now I would request the delegates to put forward the resolution in the committee.
The delegate of India would like to put forward the resolution.
Please proceed with it.
Thank you. Is my screen visible?
Yes, delegate, please proceed with it.
Thank you. So the objective clauses urges the World Health Organization to take the relevant steps for people suffering from mental health issues. The requests to the developed countries to cooperate with the developing countries and help them in coping with mental health issues and various stress disorders, and the emphasis on spreading awareness and educating people on the drawbacks of mental illnesses on long term and how they affect their life as a whole. Thank you.
Votings for the resolution put forward by the delegate of India. So, keeping in mind the votes from UK, USA, Australia, Spain, France, and Russia, the resolution put forward by Delegate of India is passed in the entire committee. It has been incredible to watch over the past few minutes as voices of the young delegates seek prominence in the committee, most noticeably through the acts and actions performed by small groups and individuals. Yours is the most connected generation that has ever lived. The connectedness offers fantastic opportunities for engagement and empowerment as information is accessed, used, created, and shared to build the knowledge society. I'm sure that you will continue to benefit from the fully networked society in the ways that we can't even imagine today. I'm personally looking forward to see where the extraordinary marriage of technological advance and human brain power will lead us. I'm also looking forward to hear outcomes of the discussion during MUN. You are an inspiration to all of us. All the best to everyone. Thank you.
Thank you very much, Himika. I hope everybody enjoyed the show as much as we enjoyed organizing it for everyone. Now, I would request Seema ma'am to encourage the children with her golden words.
Respected Principal Ma'am, dear parents, and my dear children, very good afternoon. Well done, children. We are really feeling proud. During this pandemic, even our children are moving ahead with full enthusiasm and positivity. Congratulations to all of you, organizers, as well as my dear children. We are feeling proud today. Thank you very much.
Thank you so much, Seema ma'am, for your encouraging words. I would now request our worthy principal ma'am to shower her blessings on the students and share her views.
Thank you, Sonal.
Thank you, ma'am.
Heartiest congratulations to all my students who were today the delegates and Secretary General for today's MUN. The way the whole program was conducted, it is highly appreciable. Special appreciation for Social Science Department headed by Mrs. Sonal Sood. Each one of you spoke very well on a topic which matters a lot. Dear children, life is never a smooth ride. It is full of ups and downs. Human race was running at a dangerous pace. Suddenly, God planned to put brakes on to the movement of all of us and gave us time to sit back and reflect. There is no cure in sight, but we all believe that silver lining will soon appear. Every country is trying its best to cope up with the situation in the best possible way. But lockdown during this COVID-19 pandemic is taking some of us towards mental health and stress disorders, which were discussed in detail in today's MUN. Someone very rightly mentioned that people who are keeping them busy, who are interacting with their friends, family, and are occupied constructively, they are not facing any kind of mental health and stress disorders. All the schools across the globe need to be appreciated for keeping the children constructively busy during this time. And as individuals, it is high time that we straighten out our inner self, stop playing the victim role, and take charge of our lives. One of the delegates had mentioned we have to light ourselves like a bulb. Light the inner bulb and bring about brightness inside and around yourself. So, once again, very well done, children, and congratulations, Social Science Department.
Thank you very much, ma'am. Your words means a lot to each one of us. Your words are an inspiration to all of us. Thank you once again. Judges surely are going to take little time to compile their results. Children, I know you all are very inquisitive to know the results, but we will share your results by the evening. Thank you very much, everyone. Let's call it off a day. Thank you, everyone, for sparing time from your busy schedule. Thank you so much. Sanjana, thank you so much. Thank you. I can't.